Hi, my name's Danny. I'm the physician assistant student today. I'll be doing your general, vital, skin, HEENT exam. Can you go ahead and take off your shirt, shoes, and socks while I go wash my hands? Okay, I'm going to start the general survey. I'm noting the patient's presentation, body health status. I'm noting if the presenting age matches the stated age, apparent age. I'm noting the body's hygiene and grooming status for any foul odors or body smells. I'm noting the patient's body habitus, noting any physical deformities. I'm noting the patient's posture, motor activity. I'm noting the patient's facial expressions for any pain or signs of distress. And I would perform a mental exam at this time. Okay. Now moving on to vitals, I'm going to be doing the temperature. So I'm going to be putting this thermometer through the patient's tongue for 1 minute, and I'm going to wait until it beeps to take it out. I would also perform the patient's height and weight, or measure the patient's height and weight. And then while that's going, I'm going to be doing the heart rate. I'm going to be measuring the rate, rhythm, and amplitude of the heart rate for 15 seconds, and then multiply by 4. And then I'm going to measure the respirations in the same position for rhythm and depth for 15 seconds, and then multiply by 4. And I'm using the palm of my index and middle finger. Okay, so we got 82 beats per minute and 14 breaths per minute. And that doesn't beep, so it's probably good, I think. Take it out. Okay. 97.8. Okay. And now I'm going to go in with my blood pressure. Okay. I'm going to measure this arm. I'm going to measure the width to be approximately 40% of the arm circumference, and the width to be 80% of the arm circumference. I'm going to be palpating the brachial artery, and then I'm going to place the cuff an inch above the antecubital fossa. Okay, first I'm going to find the palpable systolic pressure. I'm going to deflate the cuff completely. Okay, now I'm going to add 30 millimeters of mercury to the palpable systolic pressure. I'm going to deflate the cuff slowly, 2 to 3 millimeters per second, listening for the first quarter cough sound as the systolic pressure and the second quarter cough sound as the diastolic pressure. Deflate the cuff fully. Okay, we got 118/70. Off the blood pressure cuff. I would perform the blood pressure in the other arm if necessary, and then I would also perform the blood pressure in the standing and seating position if necessary. Okay, now I'm going to go on to my skin exam. Okay, and the patient's skin pigmentation, for any discoloration, masses, rashes, or lesions. Can you go ahead and show me your front and then the back? Yep, looks good. Okay, can I see the palms of your feet? Your hands. Okay, great, you can go ahead and sit down. Alright, I'm going to be inspecting the skin for temperature, moisture, and texture. Temperature, moisture, and texture. And mobility and tuger. I'm going to be checking the fingernails and the toenails for cyanosis, brittleness, lines, lesions, and clubbing. Okay, head exam. I'm looking at the position of the head, size, shape, contour, looking for any deformities. I'm looking at the scalp for lesions, nits, lice, dandruff. Looks good. I'm looking at the face for symmetry, edema, masses, or hair growth, and I'm going to be, and I was also looking at the scalp for the hair growth pattern and hair texture. I'm going to be palpating the skull for contour, deformities, and masses and tenderness, and then palpating the scalp for mobility and tenderness. Okay, I'm going to be palpating the temporomandibular joint, the temporal arteries for pulsations and tenderness, the temporomandibular joint for crepitus and tenderness. Can you open your jaw? Okay, the parotid glands for edema, and then the forehead, supraorbital ridge, zygoma, and mandible for tenderness. Okay, so we're done with the head exam. We're going to go into the eye exam. Okay. I'm inspecting the eyebrows, the eyelids, and eyelashes for any asymmetry, lesions, or arrhythmia. That's weird. I'm inspecting the lacrimal apparatus for any edema or lesions. I'm noting the position and closure of the eyelids. I am palpating the lacrimal apparatus for any tenderness, and I'm trying to express any discharge from the nasolacrimal ducts. I'm going to be looking at the palpebral and bulbar conjunctiva. So can you like look down? Can you look up? Okay, I'm noting any injections or lesions, and then I'm noting the sclera for any blood or injections. All right, now I'm going to go on to visual acuity. All right, can you hold this in one hand and cover your other eye with your other hand and read the smallest line that you can read?
3, 7, 2, 6, 4, 6.
All right, and can you do the other side?
3, 7, 2, 6, 4, 6.
Okay, now both eyes.
3, 7, 2, 6, 4, 6.
Perfect. I would measure that with and without corrective lenses. I'm going to measure the pupil size for symmetry. It looks about 3 millimeters. Alright, now I'm going to test gross confrontation. I'm going to stand very close to the patient. Can you put your hands in the center? When you see my fingers come into your periphery, go ahead and point. Okay? Going up, middle, lower. Okay? I'm going to test your extraocular muscles. Go ahead and look at my tip of my pen, and don't move your head, just follow it with your eyes. Okay, great. Now I'm going to test accommodation. Go ahead and actually we'll do convergence first. So look at this pen and then follow it as it goes towards your nose. Okay, and then we're going to test accommodation. Go ahead and stare at a point at the wall. I'm going to bring this pen up to your eyes and go ahead and focus on it. Okay, I'm going to test lid lag. So just follow the tip of my pen. Okay, now I'm going to use tangential lighting to inspect the cornea and the depth of the interior chamber and noting any crescent shadows in the medial aspect. Okay, and now I'm going to be testing direct and consensual pupillary reaction. So on this side, I'm going to do direct, consensual, and direct, consensual. Okay. Now I'm going to be doing the fundoscopic exam. Okay, I'm making sure the diopter is on 0 and checking the light. I would dim the lights. I'm going to stand 4 feet away from the patient and check the corneal light reflex. Okay, and then I'm going to come 15 degrees lateral, 15 degrees from my patient. I'm going to be looking for the red light reflex. And then I'm going to be going in and I will be looking at the optic disc and margins, the retinal arteries and veins, the cup to disc ratio, and the condition of the retina. Can you look at the light? I'm looking at the fovea and macula. I'm going to perform the same thing on the other side. Okay. Okay, look at the light. And fovea and macula. Okay. I'm moving on to the ear exam. Okay, I am inspecting the auricle for any discharge lesions, masses. I'm going to be palpating the auricle, tragus, and mastoid for tenderness and masses, performing the whisper test. So I'm going to cover one ear, and then on the other side I'm going to say a 2-syllable word, and go ahead and tell me what that word is.
Cupcake.
Hot dog.
Hot dog.
Hot dog. Okay. Now I'm going to be doing the ear exam. So I'm going to choose the right speculum for the patient. Okay, so alright, so I will be looking at the external ear canal for the amount of cerumen, the any presence of inflammation, lesions or foreign bodies. So I will be pulling the ear out and back and using my pinky as a fulcrum. Okay, I'm visualizing the tympanic membrane as pearly gray and visualizing the landmarks of the tympanic membrane such as the mouse unbone cone of light. And I'll perform the same on the other side, pulling the air out and back. Tympanic membrane pearly gray. Okay. And then we go on to the nose exam. I'm inspecting the nose for any deformities. Can you plug one nose and breathe in and out? And then same on the other side, testing for nasal patency. I'm palpating for any tenderness. Okay. And then we'll be doing the nose exam. So I'll be looking at the nose for the nasal mucosa. The turbinates for any polyps, and the nasal septum for any perforations or deviations. So here we go. Oh, that's good. Nice. Okay. And then I'm palpating the maxillary and frontal sinuses. And I'm gonna go into the mouth exam. This and this. Okay, I'm gonna be inspecting the lips, the nasal labial fold. So open your mouth for me. Okay, I'm inspecting the gingiva, buccal mucosa, the floor of the mouth, the teeth, gingiva. I'm going to be inspecting the posterior pharynx and the condition of the tonsils. Can you say ah for me? I'm noting the symmetrical rise of the uvulum palate, and then can you stick your tongue? Okay, I'm noting that the tongue is midline in its color and texture. Okay, and now I'm going to test the tongue. I'm going to palpate the tongue. Put on my gloves. I need my gauze.
Use this. I have two.
Okay, yeah, we only got one.
Alright, gauze.
Gauze, okay, can you stick at your tongue? Okay, I'm grabbing grabbing the tongue, and then I'm feeling the sides, looking for induration and masses, and then the tip of the tongue. Okay, thank you. Alright, gloves off. Now I'm moving on to the neck exam. I'm inspecting the neck for any masses, thyromegaly, jugular vein distension, and symmetry. And the trachea is midline, and then now I'm going on to the thyroid exam. So I'm looking at the thyroid anteriorly and the isthmus for any edema or masses. Can you swallow for me? Okay, I'm going to be palpating the thyroid glands, right here. Okay, I'm going to displace the trachea to one side. I'm gonna palpate. Can you swallow? All right, I'm displacing to the other side, palpating. Can you swallow? All right, now I'm palpating the isthmus. Can you swallow? Nice. And now onto the lymph node exam. So I'm palpating the pre-auricular, the post-auricular, the occipital, the tonsillar, submandibular, submental, let's see, the superficial cervical, the posterior cervical. Can you tilt your head to one side? The deep cervical chain and other side. The deep cervical chain, and then can you breathe in? The supraclavicular. Okay. Done.
Thanks for watching.